Welcome everyone. I'm Janice Winter and I'm a doctoral candidate at the University of Oxford. And we're hosting a series of reflections at the Blavatnik School of Government on public policy responses to COVID-19. Today's conversation explores some of the socio-economic challenges, amongst others, raised by the COVID-19 response in South Africa. And there are few people as well placed to speak to these issues as Axolile Notywala. Axolile is a social activist and general secretary of the Social Justice Coalition, which is a democratic mass-based social movement that campaigns for the advancement of the constitutional rights to life, dignity, equality, freedom, and safety for all people, but especially those living in townships and informal settlements across South Africa. So welcome, Axolile.
Thank you for having me.
It's great that you're with us. So just to start off with some of the work you've been doing, Khayelitsha is currently the worst affected township in South Africa struggle with the coronavirus pandemic. Given your extensive experience working in this community, could you just paint a picture of what lockdown has looked like for townships like Khayelitsha and for the vulnerability of residents, both to COVID-19 itself, but also especially to the impact of the response to the virus?
I think at the beginning of the lockdown, just when it was announced, we knew that different people are going to be affected differently by the virus, but also by the lockdown in itself and the restrictions that come with that lockdown. And this is something that to us was very urgent to try and address some of those issues. And the first thing that we immediately thought people would suffer with regards to is access to water. And so a few days just before the lockdown, we had to quickly organize a protest and say, you can't lock down people without giving them water. Because if they have to protect themselves from the virus, how are they expected to wash hands if they don't have water? And this is something that we were focusing on specifically on Khayelitsha, but with the understanding that this happens across the country. And so that was the biggest emergency at that time, just before the lockdown. And as soon as the lockdown happened, we started to see, and many other issues started coming up that we've spoken about many years before previously with regards to people living in informal settlements, such as issues of homelessness, issues of not having access to other basic services, such as issues around food insecurity. And so these are the issues that we've had to deal with.
How is that looking at the moment? Are people managing to get access to water? Is there sufficient food? What is the scale of the humanitarian crisis that's unfolding?
There is access to water. There is some people have access to food, but both those things are not sufficient, and people are still struggling to try and have access to those. The response, as much as there was a response from the local municipality, the city of Cape Town, also from the provincial and national government, that response was and continues to be pretty slow because there are communities and informal settlements where water is really limited and where services are not there, where people still have to share facilities. And we know how the virus spread. And so if you're expected to share a toilet between 5 to 10 families, that's going to spread the virus. If you're expected to share a tap between 5 to 10 families, that's going to spread the virus. And so these are issues that continue, that we're still trying to deal with.
Now, just on some of those issues that you've highlighted, we've seen in the media many commentators saying that COVID-19 has exposed the dire situation in which many South Africans live. But that's not exactly true. Activists have been mobilizing very publicly around these exact issues for decades, around housing, around sanitation, access to water and basic services, the safety of communities, food insecurity, all of these things. So perhaps this has provided a more urgent incentive for government to respond, and possibly for wealthier citizens to actually finally understand that these injustices also affect their own well-being. But either way, it's taken this deadly global pandemic for the government to begin to prioritize service delivery and to show some sort of innovation in circumventing the very slow bureaucratic processes of policymaking, even if they are still too slow for the emergency. So if you could just talk about has this been frustrating or encouraging or both, and just about how it is for activists like you who've been trying to get responses to this for years?
It's mostly been frustrating to sort of scramble around these issues now when we've been raising these issues, when many other communities and community members have been raising these issues. The issue of water, if you remember, Andrew Statane was killed by the police in South Africa for protesting for water. And these are issues that people are still protesting for, because we still had to protest just before the lockdown for the same water that Andrew Statane was killed for. And so this is very frustrating. And I mean, a number of people from these informal settlements and from these communities have, some of them have even had to say, we thank the fact that there's COVID-19, because it means that now we are getting services that they should have been getting. And when many people were worrying, and everyone is worried about the virus, but to many other people, there's many other worries that they are worried about. Issues of food, issues of these services, issues of police brutality. We know of reports already of the number of people that have died at the hands of the security forces, which includes the South African National Defence Force in the country. And so these are issues that we've spoken about before, and these are issues that we continue to speak about before. I think now they've been exposed to other people who didn't necessarily care about them, or to a government that didn't necessarily care up until they see that people are dying, up until this issue of people dying is actually exposed to the media, because people have died before because of lack of services. It's just that now it's more elevated because of the fact that it's global and it's affecting everyone. It's not necessarily affecting Black, poor, and marginalized communities alone.
You know, some of these issues you're mentioning around police brutality, for example, you know, we are seeing, in addition to some of the positive signs, we're seeing that there are developments where some service provision is now being prioritized. Whether that ends up being capitalized on and continued afterwards is another issue we can come to. But there are also concerning indications of continuity rather than disruption. So we're seeing sort of, obviously, like you said, deepening poverty, but a criminalizing of the poor, where actually getting people to be locked down in one-room dwellings with, you know, just absolutely no realistic feasibility of any kind of social distancing, like you say, with shared facilities. Even possible indicators that some in power may be using this state of disaster as an opportunity to further policies that may be anti-poor. So what are some of your biggest regards, particularly in terms of that, in terms of the ability that this disaster provides for whether it's local government or national government to actually further some of the things they have been doing that are concerning?
We've seen a lot of abuse of power. This is abuse of power from these security agencies, but also from politicians, because I think police and many of the others that are part of the security forces or services, they get instructions from politicians. Politicians are the ones that have put out these regulations. They are the ones that give instructions as to what needs to happen. And so the failure when it comes to people being brutalized, when it comes to people being dehumanized, the only people or the people that should have most of the blame are those in power, those in positions of leadership. We can blame police on the ground, but these are systemic issues, and these are policy level issues. And so those people that are in power that are making these decisions should be held accountable. And we saw some of them, such as the city of Cape Town, or the politicians within the city of Cape Town trying to be opportunistic to put in laws or bylaws that would further criminalize poor people. And we know already many poor people and homeless people continue to be criminalized in the city of Cape Town. And we saw an introduction of a bylaw which many citizens, Cape Town citizens, South African citizens, pushed against, which was going to further criminalize poor people, criminalize the marginalized, and criminalize homeless people. And this is an opportunity that they were taking because they thought people were not watching. But I think we've managed to at least put a stop to that, and we hope that it's not gonna continue.
There's such an active civil society and community organizations in Cape Town that's but elsewhere in the country it's concerning. I mean, just talking about Cape Town, we've seen that bylaw which was trying to, amongst other things, enable stop and search powers and even arrest without warrants. But we've also seen other things in Cape Town in terms of the city's handling of the homeless residents, basically trying to just get rid of them essentially from the city. And now we're also seeing, we've seen throughout the lockdown evictions across cities when this was declared illegal. So if you could just speak specifically to that, because I know you've been directly involved in the fight against evictions. Can you describe what's happened that you've been involved in and your own encounters with police overreach and violence?
Yeah, I mean, the biggest worry is the fact that at this particular time, at this particular moment, during a pandemic such as this, you would expect that the government that is closer to the people is the one that's responding to this, which is local government. And if you look across the country, the only, I would say, claim as or they would claim as a success as in local government in terms of their services would be evicting people and making people homeless. That's what has happened across the country. That's the only thing that they can claim that they have done to respond to the pandemic. They haven't responded effectively to issues of food security. They haven't responded to issues of basic services. They've just been able to brutalize people, make them homeless, injure people during that process. And this is where we got involved in one of the communities here in Cape Town, in Khayelitsha, a community called Embolweni. Which just before, or a few months just before the lockdown, people have started to occupy land, and there's many reasons why people do that. But we saw some of these things happening just before the lockdown, because and the majority of the reasons for that during this time is that people are not working. And people that were renting in backyards did not have the money to pay rent anymore. And therefore, even though there was a moratorium on evictions, this is something that was not properly monitored or properly enforced with respect to individual landlords. And so people were evicted and people had to find other ways or other pieces of land for them to try and live and be sheltered, because people were being told to be at home. And so they wanted to be sheltered and to try and protect themselves. And the response was no communication, no engagement with those people. We saw the same response that we continually see from a government that doesn't care, that it was brutality, it was rendering people homeless. At the beginning and the start of the winter months in Cape Town, people had to sleep outside while it was raining, while it was cold. And some of us that were involved in trying to stop that happening, I was myself arrested. I was myself victimized and pepper sprayed, and some of my colleagues were victimized as well. And so that's the response that we've seen from local government, which shows an uncaring city towards the marginalized.
Yeah, and uncaring cities across South Africa, which is concerning. I mean, in your specific instance, it's such a clear example of the way in which Police are not responding with any kind of degree of proportionality or necessity. You were in the back of a police van with other people, so not able to socially distance, and the police officer, if I'm not correct, sprayed pepper spray into the back of the van, just to punish you.
Yeah, I mean that's torture. That's essentially torture. He was trying to torture me and my colleagues, because these are people that normally do this and get away with it without anyone having to document and show and hold them to account. And so when we tried to do that, they tried to use other means, and I'm sure they've done that elsewhere. This was not the first time. They've done that elsewhere, and they've gotten away. They've gotten away with it. And this is something that's really important, I think, in the country, in that accountability mechanisms towards the police, those that exist are not effective, or they are weak, and that's something that's really needed to make sure that not only the South African police services, we know that municipal police continue to brutalize people. We know that organizations such as Axolile Notywala, for example, in Durban, their members have died. They've been assassinated. They continue being brutalized by Metro Police and municipal police. And there's no oversight institutions or mechanisms to hold these municipal police accountable. And that's what we think is really needed at this point in time, but also going forward.
And this particular time, we're seeing, other units deployed in addition to those policing. So specific tactical response units who we know have been implicated and have had widespread impunity with things like Marikana, the murder of 34, mine workers in 2012. So this is clearly not new. It's a systemic issue, institutionalized culture within law enforcement that needs to be addressed. In terms of government specifically, do you think government has a sense of the lives of its people? Do you think they know really what the lives of the majority of citizens and residents looks like? And how would you say the residents of townships are viewed by various levels of government, what the relationship is like?
It's really saddening and disheartening that many of those in government are people that we assume come from townships, are people that we assume come from some of these communities. And now that they are in those positions of power and positions of privilege, it seems like they've forgotten the lives of the people that are living in informal settlements. And they only remember those lives every 4 or 5 years, just before elections. And I mean, to be so ignorant that many of our mothers and grandmothers and grandfathers have to sleep outside to queue for grants. Like one of the mothers was saying, how is it that we have to come and queue here and sleep here at this point in time when we're in need? But when politicians are in need, they are able to find us in our houses to say, we want you to vote for us. But now they can't find us at our houses to do these applications for grants for us. And so that shows the levels of an uncaring government. That the only thing that they care for is to continue being in those powers, positions of power and positions of privilege. And I think many people have seen that. That the response to many of these communities, majority of it has not been from government. Majority of it has been from local community organizations, from individuals within these communities, which I think has been powerful to show that people are able to do these things themselves, and they're able to take care of themselves, and that government response has failed and continues to fail, and we need to critically look into that and do something about that.
I think one of the most powerful images has been of elderly residents queuing overnight in cold weather, waiting for to apply for grants or waiting, to try and resolve issues with grants when the need is greater than ever, and yet, there's more restriction than ever in terms of the amounts of people being seen each day on particular days, and the communication being very poor about those limitations. In terms of, President Ramaphosa has been celebrated for announcing the stimulus package of 500 billion rand to include efforts to alleviate the suffering. But as notwithstanding criticisms of that actual stimulus package, which we're seeing from many of our economists, but implementation is so critical to any of this working, particularly, as you say, by local government. And so can you just a little bit more detail outline some of these issues that you're seeing at the moment in implementation with regards to grants, food parcels, etc., and even the government's response to these sorts of community initiatives, civil society initiatives that are trying to sort of fill the gap?
I think what we've seen is that the bureaucracy that you normally see in other times, and the red tape that we normally see in other times within our government has come out in these issues when other people are trying to respond and respond creatively in ways that are inviting to many other people. We've seen people that have started community kitchens being stopped while they're trying to feed their families because of certain regulations that government wanted to impose. But we've also seen this issue of technology coming into play in that, again, this is something that has been raised before. There are issues with regards to technology, especially in townships, not having Wi-Fi, not having access to the internet, the high cost of data, and there are campaigns that have been dealing with this. And this is something that has never was never put into the center of debates by government, and it still hasn't. I mean, if the majority of the communications now from government towards its population happens virtually, why is the issue of data not being addressed? That should be the biggest issue, the biggest thing that government is addressing now. We know that schools are opening now, and there were statements that were issued by the the Department of Basic Education. That information didn't get to many people because some of that information was tweeted, some of that information was released on Facebook. Many people living in our communities with their children didn't get that information because, again, the responses that are coming from government, they do have a class bias. Because they do not prioritize poor and working class and the most marginalized within our society.
Yeah, and actually just to follow up on that point about government communication, like you say, it's been noticeably inaccessible to poor communities. And I'm interested to know how that is playing out in terms of the issue of stigma. So given the fact that many communities are not actually getting updated, accurate, accessible information on the details of the virus, on explanations for evolving government responses. And this is on top of a country that's had extremely difficult experience with an HIV epidemic and a very poor government response to that. So I can imagine that this very, very stringent national lockdown to a new virus, one that doesn't have a cure or a treatment, must result in a complex community fear. And if you could just discuss that briefly, a little bit about the prevalence of stigma, if it is, and how that is sort of working itself out in communities.
So the one thing that should have been prioritized by government is the issue of communication. Even before deciding on the lockdown and saying that we're going to lock down now, there should have been efforts to make sure that everyone has information about the virus and that everyone has information about how to protect themselves and how to protect others from the virus. That's something that was missing and that continues to be missing even now. Hence, we have seen issues around stigma and again, issues of misinformation and people getting and taking the information that they get, that they have access to, because there wasn't a properly coordinated central information that is coming from government to make sure that they address these issues. The first case that was reported in Khayelitsha of a woman who tested positive, we saw stigma in that one case, that first case in Khayelitsha, where the woman was evicted by their landlord. Because people do not understand what having this virus means, and how people recover and how people can recover, and the percentage that will need a hospital, the percentage that is likely to go to ICU, who is more vulnerable than who. This is information that I think now has gotten out to people, but stigma is still there, and efforts to deal with stigma have not been enough, have not been close to being enough in our communities from government. And I think now that we are likely getting more towards the peak in the country, we're going to continue seeing those because they have not been addressed at all.
There are very effective communication networks when there is incentive for around election campaigning, and very, very localized networks of communication that really could have been utilized more effectively. So we're seeing just an enormous socio-economic impact, and it's going to have deep and lasting consequences, particularly around constitutional rights to human dignity and substantive equality. What do you think is needed to progressively advance these constitutional rights? And what do you think would have been a more appropriate response from government?
I think we need, there's a lot of systems within our government that needs to be reformed. I think a lot of, especially again, I emphasize this within local government, which has been missing in action in many of the responses. Our local government doesn't plan. It's a responsive. It's not even a responsive. It's a reactive government that we have that doesn't plan, and we need to make sure that there's proper planning, because we might be able to deal with COVID-19 now. Another epidemic is going to come out, and if we're not prepared for that, more people are going to die, and the more people that are going to die are poor, Black, and working class South Africans, and so we need to critically look into our policies and reform those policies to make sure that they cater and they are responsive for the needs of the most marginalized within our society.
The few service provision interventions that we have seen, of course, it's some of it's positive, but we don't know how the continuity that will be seen in that, and also the difficulties around having to emergency responses and having to quickly implement things that haven't been carefully considered, that haven't involved participation from communities, that may not be sustainable or ideal in the long term. So I think the activism of organizations like your own are going to be really, really important in the years ahead. I just want to talk about civil society and some of the complexities of what that looks like in the South African context. We're seeing a lot of large, formalized NGOs being vocal in their involvement and lobbying around elements of the government response. And while no doubt they're playing a vital role in many respects, I imagine there's nonetheless very complex dynamics in that for social movements like your own, particularly around the degree that they claim to represent marginalized communities. So could you describe some of those complexities as they're currently playing out, and just generally within the context of South Africa more broadly?
I think living in an unequal society where class issues and race issues are there every day, these are issues that are bound to come out in every institution, in most spheres that we are involved in, and we've seen them before. We continue to see them now, even within civil society spaces. And so when we try to deal with these issues and trying to address these issues within government, or towards the state and towards government, we always need to reflect on our own ways of doing things, because we live in a society where we have different classes and different people with different privileges. And so these are things that are going to come out, and the complexities within are not going to be easy, and addressing them is not going to be easy. But I think what is important is that we start talking about them. We start acknowledging the privileges within our society, the race, the class privileges within civil society, and knowing that there is a prioritization of NGOs that get more funding than those organizations that do not necessarily, I would say, have structure, or are not necessarily as registered, or do not necessarily have people that have gone to university to get degrees and that are employees. And these are issues that we should critically reflect on now and deal with them now and post the pandemic as well, to make sure that our society, the society that we live in and that we work in, is more equal, not only with regards to where and how services from government are provided, but also how we approach things ourselves within civil society.
I think there's a big lesson to learn, especially for the donor community. I was involved in that space in South Africa previously, and I know, how difficult it is to try and persuade donor organizations, to fund organizations that require more flexibility and dynamism, that don't necessarily have audited financial statements set up, that don't necessarily have large boards that can, just the need for more innovative and dynamic and flexible policy, donor kind of responses to enable communities that are actually embedded, community organizations that are actually embedded within communities that they're working with. I think that's a huge, huge issue that needs addressing. Just coming back to some of the positive things that you've seen, in terms of community responses and some of these soup kitchens you've seen starting, and in many ways they are the realization of what President Ramaphosa has called a new social compact. In whether we'll see that expanding beyond to the government and to other sectors of society, it'll be important to try and mobilize that. But what are some of the more hopeful developments that you are hoping can be continued and expanded after this crisis?
I mean, having worked within this space for a number of years, we've had challenges with government, and we've confronted government, and I think in times like these, as much as we continue to be critical, and we should continue to be critical of government at all levels, where there are opportunities to work with government, we must do that, because we are responding to an unprecedented virus, or it's an unprecedented time, and therefore government alone is not going to be able to deal with this, with many of these issues. And also because of the fact that we in our local communities understand our communities better than government. The people that are in government, and especially politicians, these are people that we know come every 5 years to our communities. And therefore, for any interventions that need to come to our communities, we need to be the center of those interventions, and we need to direct what government has to do. And sometimes we have to partner with them, but not necessarily taking the lead from them. They need to get the lead from us. And we've seen some of that starting, I think, through some of the work that I myself have been involved in, through a group called Cape Town Together, a network of different communities, local communities that have started community action networks in local communities. There's over 170 community action networks across Cape Town. And this has started now in other provinces as well. There's in Gauteng, in the Eastern Cape. These are community groupings that are not necessarily formalized. These are organic community groupings that are starting to organize. and calling for organizing from their own communities, and pulling in resources, and sharing resources, sharing strategies of organizing, and learning from each other, and trying in a very small way to try and bridge the gaps and the divides that we know in the city of Cape Town, a city that some know as a city of islands, a city that is very divided. And so trying to connect the different corners and different parts of Cape Town through local community organizing. And this is something that I think is important for government to take note of. Not to take note of and to use it for electioneering purposes, but to take note of in terms of the fact that these are the structures that are going to assist in making sure that service delivery is easier moving forward, and they need to start working with these structures, not take over, but work with these structures, and be led by these local community organizing structures.
Amazing. And if you could just speak to some of the connections between those groups. Are we seeing, to what extent are we seeing sort of solidarity across different classes, different races? Is there, the space for communities to be leading in being honest about the assistance and the responses that they need from other communities? How is that playing out there?
Yeah, we've seen solidarity. We've seen partnerships with regards to communities and community action networks, that those that have partnered with those that do not have, but working on the basis of trust, and on the basis of solidarity, not charity. And that's something that is important to emphasize. Because if it continues to be around the levels of trust and solidarity, then this is something that hopefully beyond COVID-19 can continue. And so I think that is something that is important. It's at a very small scale, and if we are to start to think about dealing with the levels of inequalities that we have, especially in our cities, in our metropolitan cities, these are issues that we need to start taking note of, that cities should be welcoming to everyone, that these issues of inequalities, class, race, and segregation need to be dealt with by citizens of the city of Cape Town, for example, and across these divides. And so this is something that I think is very important and very critical, to make sure that we continue emphasizing it and continue organizing more, and to continue reflecting and introspecting and criticizing ourselves where we see these class biases playing out, even within these partnerships that we are working in.
They don't replace the need for large systemic transformation and massive radical policies at the national and city level, but I think very important in showing will to even see those policies being implemented, and a space for mobilizing around change across divides, which I think offers a lot of hope. And so to end on that kind of note, you and many of your colleagues and comrades show remarkable resilience in retaining a politics of hope, despite honestly what are really difficult circumstances that I think many would feel despairing in. So this must take a lot of work and a lot of energy. So if you could just end by describing how you maintain that and what sort of energizes you in that regard.
I think when we do this work, and doing this work for us, it's not only been just trying to respond to a pandemic. I think it's important that we've done this work and we continue to do this work, but we reflect on what is wrong within our society and what is needed within our society. And we talk about these things, that this is political. And we need to try and introduce different politics within our society, the politics of hope that you speak up of, and the politics of care that we need to sort of introduce to our communities, but also practice ourselves. Care for our communities, but also care for ourselves. Knowing when you need to take a step back and rest, because we respond to these issues and sometimes we get burnout. And these are critical reflections that I think are important. And I think what keeps us going is also the fact that when we respond in this manner, one smile that we see is very important. We know we're not going to resolve issues of the world, issues that have to do with inequalities, capitalism, and all these isms. They're not going to be over tomorrow. But I think assisting one family, assisting one individual goes a long way in dealing with this with this current pandemic that is difficult for many people. And so I think caring for each other is important, and having conversations amongst each other while we do this work is important as well.
You're doing such critical work. It's so important, and massively respect you for it. And so, yeah, I just want to thank you so much for giving us your time. It's been an absolute privilege. So thank you very much.
Thank you for the opportunity to share.
And good luck.
Thank you.